Got it. Hi, my name's Tim, and today we're going to be doing the head-to-toe assessment. But before I begin, I would like to get consent from my assistant Shannon here that she is being recorded, and this is being reviewed by Nightingale faculty for training and education purposes.
I consent to being recorded and being observed for education purposes.
Okay, great. With that being said, I'm going to go ahead and begin. I'm going to first start with hand hygiene and grab some gloves here. And I'm going to go ahead and enter my patient's room, knock on the door, close the door behind me for privacy, close the curtain, and introduce myself to the patient. Hi, my name is Tim, and today I'll be your nurse. Welcome to MedSurg. Can I get your first and last name and date of birth?
Yeah, my name is Shannon Hanlon, and my birthday is March 14th, 1991.
Okay, great, and that matches just fine. Looks like you're here from a post-op from an abdominal hysterectomy.
Mm-hmm.
Are you in any pain right now?
No.
Okay, no pain. And with that being said, I'll go ahead and get her vitals. Her vitals are 98.6. BP is 122/74. Heart rate is 76. Respiration's 18, and SpO2 is 99 in room air. Shannon, do you know where you're at right now?
Yes, I'm at MedSurg at UC Davis.
Okay, good. And is it day or night?
It is daytime.
And who is the president?
Donald Trump.
Okay, great. And do you know why you're here?
Yes, for the visit after my post operation.
Okay, so we just assessed her A&O. She is A&O times 4. So now just about what we're going to do real quick. You're new to the floor, so what we do whenever your patient comes in is just do a quick head to toe.
Mm-hmm.
It's just from the top of your head to the bottom of your feet.
Mm-hmm.
Just checking for scan, checking for anything, just to make sure that we cover our bases here, okay?
Okay.
Is it okay if I touch you?
Yes.
And before I actually begin the head to toe, I'd just like to say by observing my patient, she seems calm, relaxed. I don't see any pain or distress as she verbalized she is a 0 out of 10 pain. I don't see, she seems well maintained, groomed, and eye hygiene is adequate. So I'm gonna go ahead and begin. I'm gonna start with your scalp here.
Okay.
We're just gonna be checking for any balding, any hair loss, any abrasions, bumps, lesions, anything like that that may have missed on assessment. And hair looks hydrated, well maintained, no balding, nothing noted. I'm gonna go ahead and move on to your temporal here. Any pain or tenderness when I push there?
No.
Move on to your sinuses. Any pain or tenderness there?
No.
Okay, we're gonna move on to your lymph nodes here. Any pain or tenderness there?
No.
Okay, we're gonna move on down here to your trachea. Trachea is midline. Any pain or tenderness?
No.
Okay, great. So now what we're gonna do is we're just gonna do a quick check of your coordination of your eyes.
Mm-hmm.
So have you look here and then look over to your right and back here.
Mm-hmm.
Do one more time to the left without moving your head. Look here and then look that way and back. Okay, good. I'm going to go ahead and shine this light and we're going to test your pupil reaction. Do you mind putting your hand up here to divide your eyes for me? Great. Mm-hmm. Upon observing, patient's eyes are symmetrical, rounded shape. There is no, they are bilaterally equal in size. And now we're going to go ahead and check for, keep your eyes straight forward for me. Don't follow this, keep them straight. There you go. One more time here. Pupils are round and reactive to light equally bilaterally. They're equal size. Conjunctiva is pink and sclera is white without any redness or yellowing of the eyes. We're going to go ahead and move on to your nasal passage. Do you mind if I look up real quick in there?
Mm-hmm.
Perfect, thank you. And do you mind closing one and blowing in and out for me? Do it one more time so I can observe. And then one more time that way. Okay, the patency of the nares are dry. Well, they're moist and nothing abnormal there. As far as the findings, the nose is midline with no deviation noted. And so from that point, we're going to go ahead and move on to your mouth. Lips by observation are pink and moist with no dryness. Can you go ahead and open for me and say ah? Okay, uvula is pink and moist, tongue is pink and moist, no dryness. And let me go ahead and see your teeth. Can you just go ahead and shine it like that?
Mhm.
Perfect. Dentation is adequate. Hygiene is appropriate without any yellowing. Okay, and then we're gonna move on to, I just wanna check real quick here for your JVD.
Mhm.
Okay, nothing there. JVD is not noticed. Jugular vein distension. And now we're gonna move on to the ear. So we're gonna do a hearing test as well as I'm gonna check your tympanic membrane, okay?
Okay.
So as I'm checking the ear here, I'm gonna have you cover the other side. Tympanic membrane is pearlent gray without any drainage noted.
Mhm.
I'm gonna go ahead and whisper a number to you and then just read back to me, okay?
Okay.
1.
1.
Okay, let's go ahead and do the other side.
Okay.
Tympanic membrane is pearlent gray with no drainage or yellow or earwax or anything. I'm gonna whisper another number to you.
2.
Okay, great. Now we're gonna move on to the respiratory.
Mhm.
Okay. So first I'm gonna push against your thorax here,
Mhm.
and just tell me if there's any pain at all with that.
No pain.
No pain. Okay. Now I'm just gonna go ahead and listen to your lungs. Okay.
Okay.
And you can just sit right there. That's fine. You get to sit normal.
Okay.
Yep. Just take your deep breaths in now for me. Take it on the back side again.
Mhm.
Lungs are clear bilaterally in all lobes with no diminishing or coarse crackles or anything noted. Now I'm going to go ahead and just during that time, I'm going to go ahead and just check her pulses here. And as I check her, give me your hands.
Okay.
And as I check her pulses here, what I'm checking for is also, I'm just going to observe her rise and fall of her chest and see that her laboring, her chest rise, there are no accessory muscles are being used, as well as there is no labored breathing at all included in this as well. Have you had any coughing at all or anything that you've experienced lately?
No.
Okay. Her pulses are +2 bilaterally, and we're going to go ahead and move on, and we're going to assume as we did the pulses, we're just going to go ahead and move down to the other pulses here. We're going to do the posterior tibial here. Those are +2 bilaterally, and the dorsal pedial. Those are +2 bilaterally as well. And as I do that, I'm just gonna go ahead and check your cap refill here. So give me your hands like this.
Mhm.
And we're looking at the nails. Nails are intact. There's no abrasions, no cracks. And we're gonna do the same thing here on the feet. Same thing with the nails here. Nails are intact. No chippings, nothing like that. Cap refill is +3 on both sides, bilaterally. And now we're going to go ahead and I'm going to listen to your heart sounds, okay?
Okay.
S1 and 2 are noted with no murmurs or any abnormalities. I would like to note too, during that time, there would be a 60-second point where I would listen to her heart rate for the full 60 seconds to make sure that I didn't hear any heart issues or any murmurs or anything that would be noted otherwise. Okay, so now I would like to go ahead and have you lay back. We're going to go ahead and assess your GI. Have you had a bowel movement and have you urinated today?
Yes.
Okay. How was your bowel?
It
Was
was.
it
Okay.
was it soft, firm?
It was soft. Normal.
Soft, normal? Okay.
Yeah.
Soft. And how many times do you go per day?
Once.
Once? Okay. Great. Okay, so I'm just gonna go ahead and test here. I'm just gonna palpate each quadrant. Any pain at all?
No.
No pain. Okay. I also like to note too that she did come in for a abdominal hysterectomy. So I would be very cautious when touching her in this region because it's normally right above the pubic bone. So I would make sure to be very careful, but as well as do my assessment thoroughly. I would, of course, assess the site, make sure there's no drainage, no yellowing, no discoloration, and no excessive bleeding. And I would observe how it would look, how the site would look post-op, either in staples or count the staples or count the stitches as well. Okay. What I'm gonna have you do is I'm gonna have you stretch your ankles out and back up.
Mm-hmm.
Just your ankles.
Just my ankles like that?
Yeah, just like that. There you go.
Okay.
You do that on your own. And then I'm gonna have you lift one leg up and the other leg up as well. Okay, great. And then, is that difficult at all? Any pain?
No, no
Okay,
pain.
great. Any pain at all in your joints when you're moving? If you move your wrist, can you move your wrist like this?
Mm-hmm.
You could sit back up if you like. And then can you rotate your arms like this for me?
Mm-hmm.
Okay, great. Awesome. Okay, so what I'll have you do now is I'll have you stand up.
Mm-hmm.
And I'll have you just take a walk that way. And as she walks towards you guys, I would be assessing her gait. And you can walk back this way. Perfect. And then I'm gonna have you put your hand. I'm gonna make sure you can see me. Sorry. Put your hand on your nose here, and then kind of switch between one hand up. Sorry.
One hand up. Like
Yep,
this?
and then swap.
This?
Perfect. Yep. Okay. Yeah, you could have a seat again. Just sit on the edge of the bed.
Mm-hmm.
We're just gonna test your reflexes as well. Okay.
Okay.
All right, so I'm just gonna hit here, make sure they can see that.
Mhm.
5 is here, and you could rest your feet.
Okay.
Okay, reflexes are noted, you can go ahead and sit back down like normal. And now what we would do after this point is we assessed everything that we needed to assess. I'm just trying to think if there's anything that I am forgetting off the top of my head. I would say that during the assessment, the main thing I would do is I would check for any on the bony prominences of the skin. I would do a full check on everything. I would check under the heels, so that's all I'll do now. Check under the heels. I would check for any tenderness, any redness, any discoloration as well. And I would just kind of check everywhere. For the sake of privacy, I wouldn't take anything off at the moment. But I would check her backside. I would of course check the site. I would check under the skin flaps for any build up, any redness, anything like that. I would check in the groin area as well as the coccyx or bony prominences there to make sure that there was no skin breakdown that was being caused. And I would check for the skin that it was dry and intact. If it was moist, I would note those things as well. With her, her skin is dry and intact with no discolorations on any point of the skin. And yeah. Now that the head to toe part is done, what I would do now is I would provide some education for her. So I would let her know that, so you have an abdominal hysterectomy.
Mm-hmm.
So something that you can do to help this process is to make sure you drink adequate fluids. Mm-hmm. And to make sure you increase your fiber uptake. Mm-hmm. Avoid any strenuous activity. Mm-hmm. And what really helps people is when you're doing anything, sometimes it's a little bit of pressure to help, like from moving from point to point, that could really help too. Okay. But you tolerate everything very well. Before I leave, do you have any questions for me or anything?
Not at this time.
Okay, great. So my assessment would be done. I would go ahead and take my gloves off and provide hand hygiene. And yeah, I think that would be the end of this video. Thank you.